Going through the change, a midlife crisis. There are lots of cute little phrases to describe a fairly dramatic change in our bodies when we reach a certain age. Women have been dealing with menopause pretty openly for many years. Only recently, men started joining in the conversation, looking for solutions to what's known as andropause. So here to shed light on what happens to both men and women, we have Dr. Rakesh Nanda from Grandview Aesthetics Center. So I want to welcome you back to the show.
Thank you for having me.
So let's talk about, the whole thing with men. Are you finding that more men are really kind of willing to talk about it now than used to be?
They really are, because this is a problem that affects men equally as women. And I think a lot of guys before just didn't like going on all these meds. So now they want a natural, healthier alternative.
All right, let's talk about some of the symptoms, because there are a lot when it comes to this, to kind of give you an idea. So menopause and andropause have some similarities.
Absolutely. So if you're tired, you're fatigued, you're not sleeping well at night, you stare at that clock, you go to sleep, but you wake up and you're like, oh my gosh, it's 2 o'clock. Or you're anxious, you're moody a little bit, your family's like, hey, you know what's going on? You're gaining weight, but you don't really know what to do. That's most commonly, it's your hormones that are affected. These patients will go to their doctors, and their doctors will say, oh, you're anxious, you're depressed. They'll toss meds at them, but that's never a good alternative because that has side effects. This is all natural. It's the way it should be. It's not synthetic, so it's a lot better.
And on that note, some of the symptoms you say can be kind of things that they then diagnose you with, right? Depression, palpitations. So there are things, and we always hear about the night sweats. I mean, that's kind of a key sign for women, right?
Absolutely. It's something that affects a lot of women. They come to me very commonly, and they want some alternative, something natural, something better. There's got to be a better alternative out there other than these meds, these creams, these shots that cause all these side effects. That's what this is. That's what we're offering in Columbus now.
And now, what age does this start to happen?
Most commonly, it's in your mid-30s, but it can actually happen at any age, but mid-30s on up.
And what causes all of this?
It's a hormonal imbalance, and it doesn't mean you're born this way. It just happens. It can happen at any age group, but that's where we come in.
Okay, where you come in, let us know what you can do for folks.
So this is basically what we do. You take a short survey. It's a 5-minute survey, and then we can actually judge very well if you're a candidate or not. If you're a candidate, we then get a simple blood test, and then we put those medicines, those hormones, into what's called a pellet. We implant that just below the skin, and over time it releases, and it gets you right back up to optimal levels. No shots, no medicines to take, no side effects.
And I love that you were talking to me a little bit about this before the show. I'm a breast cancer survivor, and a lot of times you kind of get nervous about hearing hormones, because hormones are what feed tumors and things like that. But you work with a lot of cancer survivors. You can lower the risk of cancer. So tell us about that.
So we work hand in hand with a lot of physicians and oncologists that deal with cancer survivors. And in fact, some of our biggest patients and largest group of patients are cancer survivors. So when you do these pellets, if you do it correctly, you follow our regimen, we can lower your risk of breast cancer 20%, 25%. Prostate cancer in men, we can lower your risk of getting osteoporosis. We can lower your risk of ever getting a heart attack or a stroke. We can really, really change your life, but do it a natural way.
And the best part is that you are a full-service spa, right?
Absolutely.
So how does that come in when things happen?
So a lot of women, when it comes to hormone stuff, think, oh my gosh, well, if I get testosterone, I don't want to become more like a man. I don't want to have hair. Well, we do laser hair removal. We do wrinkles. We do Botox. We do liposuction. We do full facial resurfacing. So we're right there on site, ready to treat any of these things that may come up. Very rarely do they come up, but if they do, we have the answers to that.
All right, and let us know some of the improvements that people are seeing once they go through this.
So here's the thing. So we'll have our patients call us even the next day and say, I've slept so well. I haven't slept this well in years. My husband is happy again. Our sex life is back to where it used to be. I'm losing weight like I want to when I work out. Men are saying we can go back in the gym. We can really, really bulk up and get to where we want to be in our workout. But the nice muscle mass, not the fat. And at the same time, you're doing something healthy. You're preventing prostate cancer in men.
And it's all natural, which I think is the one thing that a lot of people are looking for these days.
Absolutely. We use a compound pharmacy that actually is very, very secure, very sterile. And so these are not synthetic pellets. These are not synthetic hormones. This is natural. So it's all healthy.
And this is coming, you said the West Coast, very popular, and you're bringing it to Columbus.
We're bringing it to Columbus. We're bringing bigger city medicine to Columbus. So.
Okay, and how can somebody get in contact with you?
So you can go to our website, greatskinohio.com, or you can call us directly, 614-421-SKIN. Our staff is there available. We pretty much answer phones all day, all night. So any of those options.
All right, sounds great. I want to thank you for being with us.
Thank you for having me. Thank you.